The staff is going to attempt a first at Gulf Coast today as they get ready to meet a special new patient, a 6-year-old white Bengal tiger named Nia. She's a rescue who lives 5 hours away at the Pride Rock Wildlife Refuge. Over the last few months, she's been hemorrhaging during her menstrual cycle. Nia has never given birth to a litter. Her owner called Dr. Brian Beal.
This tiger is having reproductive problems, basically having discharges and occasionally mild infections. And what we're going to try to do is get that uterus out of there.
They're going to have to perform an ovariohysterectomy to remove the uterus and ovaries. But there's a twist. Gulf Coast is not equipped to house the tiger overnight. The surgery must take place quickly enough that she can go home the same day.
That table's on wheels, so we can just wheel it out, right?
Oh, yeah. But being that this guy is so big, we're just trying to clear the way to make it easiest for us to come into the OR, move out of the OR.
It's a complex procedure. The animal weighs 350 pounds. Dr. Beal assembles 2 interns, 2 additional surgeons, and a team of veterinary techs, as well as exotic animal expert Danielle Inman to assist.
Hey, Gary.
Hello, doctor.
So we're all here to give you some help.
We're glad to be here.
How was the ride?
It's not been one of our better moments, but
Is she worked up? Can I take a peek at her?
yeah.
All right.
They're also attempting something brand new, to use a minimally invasive technique. A hysterectomy like this has rarely been attempted on a tiger before.
Holy there's a tiger here. Those bars don't look as big as they need to be when she's behind them and she's growling at you.
It's amazing to hear a tiger roar in the middle of Houston, Texas. It really made her presence known, and it got all of our attention.
After the long car ride, Nia is restless and unpredictable. Dr. Caleb Hudson has the most experience with tiger surgery on this team.
Big cats they're very powerful creatures, and even if they're tame and they're used to you, it can be unsafe. We won't really be able to get close to it and do much of an exam on it until it's heavily sedated.
If y'all just want to give me maybe 60 seconds with it on myself.
Sure.
One of Nia's handlers attempts to calm her, while a zoo veterinarian gets ready to administer a cocktail of sedatives powerful enough to temporarily knock out a 350-pound tiger.
It's been nice knowing you, Joe.
When I hear big cat surgery, there's a couple things that come into my mind, and one is keeping the cat asleep. So we've brought in an exotic animal specialist to handle the anesthetic and also the pain management of this big cat.
So I'm going to need to be either on that side or she's going to need to be on this side. Is the back open?
Yes, sir. That's what I was thinking.
All right.
Nia's in an agitated state. They do not want her to attack the cage and injure herself or the people around her.
Hi, baby.
One second.